had worked with different autistic children and kind of young children. And I thought, oh, are there, teaching careers or something I'd like to learn more about? And I remember reading in a college handbook, and I came across, it's called Communicative Disorders as a major. And so I started reading about communicative disorders years ago and thought, oh, this is really interesting. It sounded exciting because I wanted to do something with children. And I had worked with autistic children. And so I thought, oh, maybe this is something kind of like teaching, but a little bit different. So I found this major in this college handbook, and I went to observe a family friend of ours who was a speech pathologist in the schools, and saw her work with young children who had difficulty stuttering, and some children who were ESL children just trying to learn more English words, some group therapy. And I loved what I saw. I was really intrigued by it. So I ended up kind of deciding on this as a major early on in my college experience, and got a bachelor's degree in communication disorders, or like I said, communicative disorders. In order to work in the field, you need to have a master's degree in communicative disorders as well. You can have a bachelor's degree and work as a speech therapy assistant, but there's not many speech therapy assistant jobs out there. So what I did is I got my undergrad degree in communicative disorders from San Francisco State. I apologize too if it's noisy. There's a little bit of background noise, so let me know if you can't hear me. So I got my bachelor's degree in communicative disorders. And then I took a year off in between my undergrad and my grad program just to get some more work experience. And it was great. What I did was I did a year working for the county office of San Mateo as a SDL teacher, which is a severe disorders of language teacher. So I taught a kindergarten SDL class, kind of a special ed class. It was considered of kindergarten age students who had varying degrees of autism and language difficulty and language delays. And I did that for a year. And then I went into the master's program at San Francisco State and got a master's degree in communicative disorders. In your master's program, you do a year. It's a 2-year program. Most of them are. Some of them are a little accelerated and have like an 18-month master's degree program. And in your master's degree program, other than online classes, you do an internship in a school and an internship in a hospital. And the school could be anywhere from a first grade class that you could work in for the semester to a 6th grade class. I worked with, I think it was like 6 to 13-year-olds, a wide range of children at a behaviorally challenged school here in San Francisco. And that was super exciting, very interesting. And then my last semester of graduate school, I did an internship in a hospital. You do a hospital internship learning all about medical speech pathology. And at this point, going into the hospital internship, I still thought, definitely want to work with children. I had quite a bit of experience at this time. But once I got to the hospital setting, I was even more intrigued and thought, oh God, I think this is kind of my calling. And I loved it. It was super challenging. Learning all about medical speech pathology. So ever since my internship in my master's degree program, at the end of my master's degree program, have I been working in a hospital setting with adults, which I find super challenging. So I've been doing this. I graduated in 2000. So ever since May of 2000, I've been you have to do a clinical fellowship year. It's called, when you first graduate with your master's degree, it's called a CFY. And you work under a licensed clinician, and it's usually a 9 to 12 month, 9 months to 12 months of you getting licensed and becoming your own licensed clinician. And so I worked under a licensed supervisor and did that for close to a year in a rehab setting. And then ever since then, I've been working in different acute care facilities. I'm at UCSF now. And acute care is when someone's kind of come right through, let's say, the emergency room, right, with a stroke or a head injury or something, and they've been admitted to the hospital. So you're kind of involved in the diagnostic, like the workup, to try and figure out why they're there. So I've been in these acute care settings ever since I was a licensed clinician, and I've been at UCSF in this role since December, like I said. And we see a variety of patients here. A lot of patients we see come in, like I said, let's say through the emergency department and have had a stroke. So they've had some sort of weakness. They have difficulty with speaking or cognition, understanding. There's lots of different areas where they could have difficulty from a speech, language, and cognitive standpoint. And then another thing we do, it's the same muscles in speech and swallowing. We see patients a lot for swallowing in the hospital, and we do a lot of diet modification and to ensure they're safe and on a safe diet. Because what happens after a stroke or a head injury sometimes is patients can eat or drink, and the food and liquids can go down the wrong way, and they could aspirate it and go to their lungs, and they could get sick with pneumonia. So a lot of what we do in the hospital setting is swallowing as well. And we do some different studies in radiology and at the patient's bedside to make sure they're safe with swallowing, kind of swallow like an x-ray of their swallow function. We work with a lot of patients in the ICU who have challenges with speaking and swallowing. So it's a really challenging, kind of exciting acute care experience, I should say. I love the rapport I get with my patients and my family members, because I feel like oftentimes, they're sick and they're trying to get better and they're here in the hospital. So a lot of what we do is education about exercises to help them with swallowing, exercises to help them with speech, and what we can do to really help foster their learning so they can get home and be safe again with eating and communicating. So yeah, I've been doing it for so many years. Like I said before, here I'm the supervisor now, so I don't do as much patient care experience. But before this, I did a little bit more patient care experience than I do now.
Yeah, thank you so much for your presentation. We do have a few questions, a few follow-up.
Yeah, absolutely.
So you talked a lot about the benefits of working as a speech pathologist, and obviously there is a lot of stress and a lot of challenges. So could you expand more on what you love most and what you least like about your occupation?
Yeah, those are great questions. What I love is, I think that especially here at UCSF in this challenging hospital, I love learning, and I feel like every day I'm challenged and I'm learning new things, and I love that about what we do. I think the two most important things about what I love is the challenging piece and the learning and the rapport I have with my patients, and that relationship I build with them. I think those are the two things I love about what I do. I think there are some things that can be challenging. Sometimes I feel like it requires a lot of patience with your patients, right? Because you're teaching them, and you're providing them with new strategies that maybe they can't do. So I think one challenging thing about the job would be having patience to kind of get through the day-to-day, because it could be a lot. And now, especially in this pandemic and working with COVID patients, it's stressful for sure. Working with COVID patients that are really, really sick in the hospital with pneumonia, it could be a stressful time for them and their family members as well as us, just because of the unknown. So I think you're working with really sick patients, which can be hard, and remaining kind of a patient, calm individual. Sometimes at the end of the day, you're just ready for a little break. So I think finding outlets for yourself are important in this field. So you're able to kind of, when you get off work, have an outlet and have some downtime to kind of clear your mind. We read about so many challenging patients each day and really sick patients. So I think sometimes you just need a break from that at the end of the day and need time to kind of turn your mind off. So yeah, those are some challenges and exciting things about the job. The other thing I wanted to say with speech pathology is there's so many different settings you can work in, which is great. A lot of the master's programs, at least years ago when I went, it's been a while, catered to the school speech therapist. So a lot of them are focused on speech and language with children in a school setting. But I feel more and more nowadays they have like a class in your master's program where you learn all about swallowing and speech and language issues with patients who have had brain injuries and strokes. So I feel like you could work in a school, like I said, you can work in a hospital, you can work in a skilled nursing facility, you could have your own private practice. There's so many, I feel like there'll always be a need for speech therapists. And I feel like there's always, you know, there's a large amount of settings that you can work in this role. I just feel like there'll always be the need for us, and you can kind of get out of your school situation and then decide what area is really appealing to you. Also, speech pathology or a speech pathologist and speech therapist, they're the same thing. So if you ever hear speech pathology or speech therapy, it's all the same. And like I said, you can work with children. A lot of some clinicians I work with do pediatric feeding. So I do swallowing, right, with adults, primarily adults here, but we also have a pediatric campus, and you could also do speech and language and swallowing and kind of feeding with even younger children and newborns. So there's such an array of areas you can work in our field, which is, I think, really exciting too. And it's just so different. The school speech pathologist, it is kind of one track you can take, or the medical speech pathology part is kind of another. And you'll get exposure to both in hopefully your master's program.
Yeah, I had a question. It's funny how you already mentioned challenges, because that was exactly what I wanted to ask about. So I heard that you talked about learning about medical speech pathology was specifically challenging. And but the challenges you've had in your career, you've had to encounter, can be potentially rewarding and fulfilling. So I just wanted to ask, do you remember a specific situation that required patience and being level-headed in order to really, help patients with swallowing?
Yeah, I had this one patient I can think of specifically. With some patients, we wear speaking valves. We have to place speaking valves kind of right here to allow them to communicate and swallow. And I'll never forget, this was one young patient that I worked with at the time. And I was a newer clinician, and trying to train him to wear and feel comfortable wearing this valve was really hard for him. And I remember thinking, oh gosh, what am I going to do to help him feel comfortable? So I did a lot of education, and it wasn't really working. And so this one day, without him knowing, I kind of put this little speaking valve on and left it on there for a few minutes, and he was breathing and communicating really, really well. And after a few minutes, I said, see, you're wearing it. You're able to speak, you're able to communicate. So it was challenging for me, because I felt like I had kind of used all my tools, right, to try and figure out how to help him, and thought, what am I going to do? So I think it's just trying to be creative with some of your patients sometimes can be really helpful to kind of achieve the progress that you want to see. And I also think collaboration with my colleagues is really beneficial. And I always tell my colleagues that at my last facility that I worked with, and even here, I think having a collaborative discussion and communication with your colleagues is really, really helpful. It's nice on the swallow studies we do in radiology. I always say to have a second set of eyes. It's always helpful to have a second set of eyes and ears on kind of what we're seeing on these swallow x-rays. And just get other viewpoints from my colleagues. I've said before to them, I tried this, and this with this one patient. What else do you think I should try? And so I think we all kind of have similarities in the way we treat patients, but we all kind of might have differences too. So it's nice to get other colleagues' input just to help me direct therapy, so I can help provide quality services to my patients. And we see anywhere between, at least in the hospital setting, the goal is to see about 6 patients a day, which can sound easy, but a lot of the patients are in and out of rooms, going to x-rays, really sick, you're waiting for family members maybe to be there to do some education. So sometimes it's easy to see 5 patients in a day, and sometimes you see 8 patients in a day. It just kind of depends on the day. But yeah, it's usually, at least here in this acute care setting, it's usually going in and just seeing different patients. A lot of the speech therapists here float to different floors. So we float around to different floors and see different patients on different floors. Some of the other disciplines I work with, physical and occupational therapy, they're a part of rehab as well. So we collaborate a lot with physical and occupational therapy. And they're a little bit more service driven, meaning they stay on just the neurology floor and they'll work on just with neuro patients, or they'll stay on just the cardiac floor and work with cardiac patients. But we work together all the time each day with physical and occupational therapy. We also have rehab aides that help us with treating some of our patients. And so there's a couple aides that work here full time, and they work with the physical, occupational, and speech therapist providing care for these patients. We also interact often with the radiologist, like I said, when we do these swallow x-rays, dietitians that work here in the hospital. Nurses, we talk often with nurses and doctors, and we'll let them know, I'm coming to see your patient. Can I see them today? And these are our recommendations. So there's a lot of collaboration with hospital staff, which is nice because you learn so much. I think I go back to what I love so much about being here and what I do is each day is such a learning experience in this teaching hospital.
Yeah, and lastly, speaking of learning and experience, one last question I have for you is, what advice would you give to current high school students or college students who are looking to go into speech pathology?
Yeah, that's a great question. I would ask questions and take every opportunity I could early on in my career to grow and to learn. So I feel like before I was a licensed clinician, when I was working under different clinicians that were already licensed, really taking the opportunities to ask a ton of questions, do some research and kind of read on my own, and just really learn as you go. Because I feel like once you become a licensed clinician and you're on your own, maybe you have a little bit less time for that. So it's nice before you have your own caseload of patients to go see when you're working under licensed clinicians, just to really take that opportunity to ask questions, learn, because the farther you get along in the field, sometimes I feel like those opportunities aren't as frequent. So yeah, take classes. There's a lot of continuing education classes that we're required to take every, I think about 2 years. We have to take about 2 classes, which is great. You can pick an area that you want to learn about, whether it's cognitive patients or pediatric patients or patients with swallowing problems. And I think it's just taking the opportunity to take the classes that are most exciting to you and ask a lot of questions in your undergrad and graduate experience, so you really kind of get the full potential of what's out there to become a speech therapist. Yeah, there's so many opportunities, and I think just really learning about them and asking about them early on will really give you the opportunities to really take in all there is about speech pathology and figure out what part of speech pathology you want to work in, what setting.
Thank you so much. And speaking of learning, I definitely learned a lot today. Such a versatile and diverse field. We work in a lot of settings.
Yeah, it's really exciting. I feel like I really love what I do, and I think you can see that from the different people I work with. They really want to help patients and want to help educate family members. And I think a lot of us here in this setting say we love what we do because we learn so much each day, and we're challenged each day, and we're helping these sick patients get better and provide quality care. And so it's a really exciting field. Yeah, I would highly recommend it. It's really great. We take on students regularly too, that are graduate students. So when students are in the program and doing their internship, we train them, and that's exciting too, because that allows us to learn and grow, right, as we're educating these graduate students and teaching them all there is to teach about speech therapy. So we have a couple students now that are just ending their internship, and a couple more that starts in a few weeks. So yeah, it's a great field, and yeah, I would highly recommend it. And like I said, I feel like there'll always be a need, and there's a variety of settings you can work in. So it's flexible. I feel like some staff can be on call if you wanted kind of an on-call job and just work kind of part-time and weekends here and there as you're able to pick up, or there's also full-time opportunities too.
And that's all the questions we have so far.
Thank you. Yeah, if there's ever, if you ever have any other questions or thoughts, feel free to reach out to me. And I could tell you a little bit more.